Hi there, this is Megan Visokay. This is my Module C assignment for HSC 6037, Philosophy and Principles of Health Education. This is a Health Education Promotion Philosophy presentation for Dr. Moses. Philosophy of Health Education and Promotion, the Introduction. Now, a philosophy should represent your personal values for one's view of self, others, and the world. When you combine your personal values with your field of work, you create your professional philosophy. Me personally, the freeing and functioning and behavior change philosophies are those that I identify with the most as far as my future for a health education specialist. Now, the 3 points we're going to really identify in this PowerPoint are that instruct concepts of mental, physical, spiritual, intellectual, and practical aspects of health and wellness, advocate for minority groups to promote health equity by identifying social determinants of health, and assess the needs of communities and individuals to plan, implement, and evaluate programs that promote positive behavior change. My personal philosophy statement. Health education specialists should seek to inform individuals and communities about the emotional, physical, spiritual, intellectual, social, and environmental aspects of health and wellness. By both cultivating relationships and acquiring data, health education specialists should assess the needs of communities and individuals to plan and implement innovative programs that promote positive health behaviors and increased overall wellness. Health education specialists should advocate for minority groups and identify social determinants of health to ensure that health equity is attainable for all people. Guided by ethics and integrity, health education specialists should consistently seek recent, relevant, factual research that supports the ever-changing world of health. Freeing or functioning and behavior change philosophies are the two philosophies that I identified most with from the text, and for my future as a health education specialist are the two philosophies that I probably would merge as I deal with clients and communities. Now, freeing functioning means that your choices are based on your personal needs, not the needs of others in society. And this is important because realistically, people are going to make choices with the education they have relative to their life, right? So they may or may not have control of specific situations in their life, and that's what this philosophy really identifies. So we saw in Lifelines that Dr. Wen really made it her point to talk with her community and engage with the community members to see what they needed, right? And recognize the lifestyle that they had and see how she could implement change by keeping the heart of the city. Now, sometimes we encounter health biases, and one of them are when you assume that people are lazy or don't make choices or make poor choices. And this is not always true, right? So unfortunately, those health biases can really negate some of the potential that people have to move forward with behavior change. So instead of planning solely for changing behavior, it's really important to focus on education so that people can be autonomous in making their own choices as it best affects their lives. And that's really what the freeing or functioning philosophy is about. Behavior change is using goals and self-monitoring to change habits. So people will identify the success of smaller achievements as motivation to continue moving throughout goal setting and ultimately create sustainable behavior change. Self-monitoring, evaluative feedback, and START goals yield positive behavioral and physiological results for multiple areas of weight loss. So by having those specific measurable goals, like seeing your waistline shrink, right, those goals can continue your motivation to keep making more goals and ultimately create sustainable, like I said, behavior change. Dr. Wen increased the access of naloxone as a catalyst for addressing multifaceted issues within the city of Baltimore. So she did what she could to ensure that the people of Baltimore had access to this drug as a first step in a much larger step of trying to combat addiction in the city. So she realized that this would be a huge undertaking, but by taking one step forward of increasing access, she would eventually be able to have a larger reach. Health food and convenience stores to decrease the number of cardiovascular diseases was also a way in which you could take a small step toward a much larger goal. So really learning how to celebrate small achievements as a catalyst for bigger growth is the major aspect of behavior for change philosophy. Major point of my personal philosophy is that health and wellness is part of a greater whole. So we need, as health education specialists, to instruct based on the fact that emotional, physical, spiritual, intellectual, social, and environmental aspects create a synergistic, holistic version of health and wellness. These 6 aspects really balance each other to be a great whole of health and wellness, right? So all of our choices should really be a combination of these things. One big takeaway from Lifelines was that Dr. Wen discussed that she had postpartum depression after giving birth. She noticed that she was drinking a lot, that she wasn't sleeping, that she kind of started to slide into a negative mental space, a negative emotional space, and she realized that socially, environmentally, intellectually, at work, she was struggling, right? So she realized that her life was out of balance and it was really doing her a disservice in multiple areas of her life. So by identifying ways to move forward with therapy and mental health counseling, she was able to provide herself with the tools to focus on her health and wellness. Now, realistically, the goal here is that people can be the best versions of themselves and be good as a whole entity. Advocate for minority groups. It is important as health education and behavior specialists that we promote health equity by identifying social determinants of health. Now, many minority groups have factors that affect their ability to make healthy behavior choices, and it's important that as health education specialists, we research the tools and resources to assist them in program planning. Now, minority groups like African Americans and poor people have an increased chance of obesity. So we as health education specialists know that obesity can cause a slew of other health issues, right? So how can we create or find or research resources that can assist these minority groups so that they have a fighting chance when it comes to obesity? Genetics can play a big role in health, and it's really important that we can identify these social determinants of health to ensure that the playing field is essentially leveled, right? We need to ensure that all groups, including minority groups, have great access to healthcare and resources to promote a great life. Now, another underrepresented group is the elderly. 1 in 4 people over the age of 65 will fall every year. That's a huge number, right? So identifying that we have multiple groups that are minorities that may be overlooked or may be underdeveloped in their program planning, it's important for health education specialists to find the resources, do the research, and really become a voice for these groups that may not have anyone else to advocate for them. As a health education specialist, a needs assessment is crucial. When we are looking with communities and individuals to plan any sort of plan to move forward for behavior change, it's really important to recognize that no program is a one-size-fits-all program. Every community, every individual has a different type of need that can't always be met in the same way. So resources are invaluable. It's important that we do a proper needs assessment so that we can allocate resources accordingly in the best way possible, because resources are finite. Money is finite. So it's really important that those resources are allocated appropriately. Now, data can provide context, but it's really important that you're getting into the grind to see the people, to communicate, to learn the community, and really learn what the people are wanting, right, to support their style of life. As Wen said in the Lifelines book, initial needs assessment in Baltimore took more than 4 months. Now, that's a long time, right? But anything that's worth doing is worth doing well, and that includes the needs assessment. As a conclusion statement, it's important to note that the role of a health education specialist may vary based on specialization. However, the fundamentals remain essentially the same. By viewing health and wellness as a greater whole, health education specialists can use needs assessment for communities and individuals to identify areas of gaps and potential for growth. By advocating for minority groups, health education specialists can ensure that health equity is accessible and increased for all people. When health education specialists integrate their philosophy within their campaign, they're ensuring that their approach to health education can align with the community in which they work to maximize successful outcomes. Thank you for watching and have a great day.